I am a primary care physician who's also involved in the intersection of innovation and information technology. I serve as the Associate Chief Medical Officer of Innovation for Northwestern Memorial Healthcare System in Chicago. I also see patients part-time, and I additionally am an entrepreneur and am involved in some companies building tools to make the electronic medical record easier to use and try and improve the healthcare system for everybody. I think that we've established a platform with electronic medical records, sort of 1.0. We have over 80% of physicians with an EMR in place, and we now have an infrastructure on which we can build. So I think the HIT industry really has to move into EMR 2.0. This is where we have apps and other functionalities that sit on top of the electronic medical record systems to improve their functionality, their efficiency, their effectiveness. We are looking for lots of interesting, cool companies developing innovative technologies and products that can sit on the EMRs, because we can't expect large EMR vendors to come up with every innovation and figure everything out. I think that we are going to see a couple of big areas play out. One is certainly population health. Another is virtual care. And the third is workflow efficiency. And I think that one doesn't get enough attention. But let's take those through. Population health, we're starting to see that. It's going to really rely on a change in our reimbursement system, which we're seeing, ACOs and other type of volume-based to value-based reimbursement changes that will make it easier and financially viable to start really managing the population well, although we can do it somewhat in a fee-for-service system. For virtual care, I think it's exploding. Kaiser just announced 50% of the care they deliver now is virtual care. I think even in fee-for-service entities, there's a large ability to do more care virtually. It's what patients often want, and it actually frees up the doctor to take care of the more complex care. The third, workflow efficiency, is something I'm hugely passionate about. I actually started a company a few years ago called HealthFinch, specifically designed to create apps for EMRs that actually improve the workflow and care to make life easier for doctors while making it better for patients. So, for example, we look at the whole concept of medication refills, a workflow that takes up half an hour a day for a primary care physician, but is routine and repeatable. We created a whole rules engine that takes all of those refill requests that comes in, analyzes them, figures out what to do, actually does it better than the physician themselves might do it, and then routes it to the physician's nurse or medical assistant, wherever they can delegate to actually take care of that and free up the doctor. We can free up half an hour a day just by that. We're working on other tools. We think there's 4 or 5 hours a day that can be freed up, routine, repeatable stuff that the doctor doesn't get paid for, doesn't have time to do, so they can actually spend more time focusing on more complex patients. I think we need to see a new generation of healthcare IT that actually makes life easier for the end user, the doctor in particular, while improving quality at the same time. Right now, we've got a lot of the devices that people can wear, etc. But by and large, those are mainly used by the healthy and wealthy. They are. It's a nice start, but what we really need is something that is fully ubiquitous, is embedded in our clothes, maybe nanotechnology that gets injected, something that's on our phones. We're starting to see early generations of that. It's going to be hugely important for me to monitor my patients on a regular basis. I can't count on them inputting everything. We need to make it so ubiquitous and easy for patients that it just becomes a byproduct of them living. And from that, then we need the rules engines, etc., to figure out what's going on and notify the doctor if needed, but ideally the whole team somewhere along the spectrum, either notify the patient themselves, a nurse, a medical assistant, a home healthcare worker, etc., if something wrong is going on. I think that's going to be really a fantastic future if we can get to that point, so that we don't have to rely on people to manually input things all the time.